Hello, I'm Jamie V. I was diagnosed in 2019 with goblet cell appendix cancer. I presented to the ER. I suffered from painful mucousy bowel movements, and these would take up all of my days for a long time. I had lost 60 pounds. I had a huge belly. I looked very pregnant, and I had reoccurring fevers. The ER doctor dismissed my symptoms and wanted to send me home just because I'm young. My mom insisted on having a CT scan done, and the doctor said, "How are you going to pay for that?" Because I didn't have insurance. And I said, "I will figure it out. I will make a payment plan." So the CT scan was done, and the doctor came back in and said, "So you have cancer." Talk about poor bedside manner. This is something that I think every medical professional needs to work on. They never assumed that it could be appendiceal. They just assumed it was ovarian because the way it showed on the CT scan. I had an ultrasound done to try to look at and measure the mass, but they couldn't really get any detail on that. I was scheduled quickly for a total hysterectomy with a gynonc surgeon. That surgeon knew right away upon opening me up and seeing the stump left of my appendix that it was appendiceal. And the only reason why he performed surgery was because the tumors were so big, they were squishing everything to one side, which was causing the pain when I tried to eat. So he did perform a total hysterectomy, which he had discussed with me before. I said, please do that if necessary, if it's diseased. And so I did get a total hysterectomy. And shortly after that surgery, I started feeling amazing, but it was the wrong diagnosis and the wrong surgery. I did not receive any information on appendix cancer at all. In fact, I have a hard time finding any information anywhere. I look whenever I'm at a cancer center or doctor's office, and I can't seem to find any information anywhere. Even the social worker, when she first met me, told me that. We don't have anything on appendix cancer, but I searched online and I found this support group that you should join. And she was the one that directed me to finding the community. The surgeon did tell my family that he was very sure it was appendix cancer, but could not confirm without pathology. But he prepared them for most likely was what was ahead, which was CRS, HIPEC, possible chemotherapy, and that I definitely needed a specialist. When the biopsy results came in, sure enough, it said X goblet cell. Once I got in with my specialist at UC San Diego, they ran their own pathology and stated that they disagreed with X goblet cell. Now, that really confused me. And so I had to ask my specialist to go over that with me. And he explained that they no longer use the term X goblet cell, just goblet cell. So already I was confused by the terms changing. And that seems to happen a lot with patients as the terms are still changing in the groups. People discuss that a lot. Once it was time for CRS and HIPEC at UC San Diego, I had amazing care. I knew that I was in the hands of experts making the best decisions and caring about my quality of life and my wishes. I did experience difficulty getting to that center for CRS and HIPEC and getting approved for out of network. I was on Oregon State Medicaid, and they wanted me to go to the in-network specialist that did not have very much experience. I did have to go have a consult with them, and it did not go well. I was told that I was going to die in so many years, and I left there in tears, but I had already educated myself enough to know that they were not truly specialists. And I know that because I asked them many questions. I said, how are your patients doing this many years out? And they said, well, unfortunately, they are all deceased, but this many. And I knew the still living patients. One of them has since passed. and one of them is still with us, but they all told me not to go there based on their experience, and the aftercare was not good. So I knew that I needed to get to a true specialist. So that's why I chose UC San Diego. But the state of Oregon was fighting me and denied me going out in network. So I did work with Lori Todd, the insurance warrior, to help me with an appeal, and we won. So I often do worry about people that are denied out of network care or go to these inexperienced teams or people that just give up. So I wish that weren't so difficult for patients to find true specialists. And I honestly have not had many discussions about clinical trials. I find this to be a little frustrating, but I also do not have typical mutations that they're looking for the clinical trials. I do not have KRAS or GNAS. I have like a high PD-L1 expression, which connected me to immunotherapy. So that was nice. I have recently spoken to one of my oncologists about a possible upcoming trial, but they're searching for people with those certain genetic mutations that I don't have, but he's hoping they'll make an exception for me. Through investigation, treatment, and the journey, I have gone from feeling like a hopeless, scared guinea pig and a crying mess. Every time I had to get labs drawn, I cried. I was terrified of it. And now I'm used to it. But I also am more hopeful thanks to my community and learning every day that there's something new coming up, something new being a new breakthrough. And I have hope that there's still something out there for me. And I have never technically been disease free, but my specialist really worked hard trying to get me there, resulting in a CC2 rather than CC0 after CRS and HIPEC. And I firmly believe that that surgery extended my life. I did struggle with mental health. It's not easy to accept that you're dealing with this and living with it when you're diagnosed at 37, thinking you may not even make it to 40 years old. I found the best support to come from others in the community who understood exactly what I was going through and feeling. I have a great support system with my family, friends, my husband, but there's nothing like the support from the community. And I quickly found PMP Pals Network, and I'm so thankful to them, so thankful that I became a volunteer and a mentor myself. And that's what keeps me going. I could not find a therapist taking new clients in my area or that would accept my state Medicaid plan. There really seems to be a shortage of therapists and also therapists that can understand us because, especially a young person with cancer, trying to find somebody that understands that who's never been through cancer is not easy because, as one of our own has stated, I may be in my 40s now, but I've already gone through so much that my mindset is way more advanced than somebody even older than me offering therapy. So that gets kind of difficult sometimes. But my social worker, who had been with me since the very beginning, since my first round of chemotherapy, who knew my story, she told me that she offers counseling. And so I started to see her every couple of weeks, and that was awesome. My quality of life is pretty great most of the time. And I'm thankful to my entire team for that. When I seek care outside of oncology, I'm treated as a lost cause. And I'm thankful to everybody in oncology because I don't get treated that way. So I really hope that somehow we can spread more awareness about this disease through the entire medical community so they know that we are not lost causes. And here I am at 43, still alive, still thriving, and living with disease.